Welcome all of our guests. I want to welcome all of our business partners. This evening, we're going to be talking about addiction. We're going to be talking about how CBD could really support and assist with those who are in recovery or who truly have reason to look for CBD to help with fighting addictions. So it is Women's Month. March is Women's Month, and this is a calendar of the Women's Month 2021. These are trailblazers, women making history. I'm sure that you can identify many of those women who are truly trailblazers. Ruth Ginsburg, Kamala Harris, my Sorrel Harris, Vice President Harris, Angela Davis, to name a few. But when I looked at this calendar, I was like, oh my goodness, they're missing somebody that is very dear to us here in Wakanda. It's missing. And I really want to highlight, every Wednesday, I try to remember to highlight for Black History Month. It was an African-American female physician. And of course, for Women's Month in March, I want to recognize someone. So that is Dr. Rashanda Conte. Let me introduce you to her. This is a fabulous woman, not just because she's my soror, a member of the Alpha Kappa Alpha sorority, but Dr. Rashanda Conte is a psychologist and a very strong leader. In fact, she is the founder and chief executive officer of an aspiring new substance use treatment organization in Baltimore, Maryland. Dr. Conte has an impressive resume in the field of addiction, extending over 28 years, with the majority of those years serving at Johns Hopkins Hospital and private practice. She's also served in many leadership roles throughout the DC, Maryland, Virginia area, and as a facilitator and consultant for SAMHSA contracts, including the Opioid Treatment Technical Assistant Program, the Preventing Prescription Drug Misuse and Abuse Initiative, and the Enhancing Substance Abuse Treatment Services to promote healthy lifestyles through addressing hepatitis infection amongst those injection drug users. Dr. Conte has a Bachelor's of Science degree in Applied Psychology. She has a Master's of Education degree in Rehabilitation Counseling and a Doctorate of Psychology in Addiction. She is a licensed clinical alcohol and drug physician or clinician in Maryland. So I want to surprise all of you, not only honoring Dr. Conte for Women's Month as a trailblazer in the field of addiction, but she is going to kick off our conversation that we're going to have tonight as it relates to addiction. Dr. Conte, are you out there?
I am. Oh my goodness, I get honored for Women's Month. That's
yes.
So awesome. Thank you. Thank you for that, Dr. Rita. I appreciate that. I really do. So hello, everyone. Good evening, good evening, good evening. So I thought I was coming to give some great information tonight about addictions. Had no idea that Dr. Rita would surprise me with that. So I'm very honored just to come before you all to give this information. I really do hope that it will be impactful for you, that you can take away some information that will help those that may be near and dear to you, or they may be one step removed, but nevertheless, I'm just hoping that the information will be impactful. So with that, I am going to now share my screen. And Dr. Rita, thank you so much again for that wonderful, wonderful introduction. And in addition to that, I want to share one other piece of who I am. And these two awesome gentlemen that stand there with me are Why I Breathe, Why I Live, and that is my two sons, Jordan, who just turned 23, as a matter of fact, on Friday, and my youngest, Joshua, who will be 17 next month. So just wanted to add that in there. So tonight, everyone, we're going to talk about addiction, and I'm going to come before you for just a few minutes to give you some information on addiction and what is it? What is drug addiction? We're going to talk about what some of those treatment methodologies are, and in addition to that, we're going to talk about what are some of those medications that are used in drug treatment. So what is addiction? As a clinician, there are many factors that go into a diagnosis for anyone who we believe may have an addiction. But for the sake of tonight, we're just going to talk about what we see as an overall universal definition of addiction. And that is, it is a mental disorder that is characterized by compulsive consumption or behaviors despite negative consequences. So what does that mean? That means that if there's an individual that we find that is using a substance, but despite the negative consequences that could possibly be incarceration, or could possibly be that they're having some health challenges, and a physician says, hey, if you continue to use drugs, your heart's going to fail, or your lungs are going to fail. But in spite of all of that, they continue to use, then certainly that is someone that we would find to be diagnosed with having an addiction. Now, there's some other factors. We look at what substance is used. We look at, the frequency of use. So there are many factors, but universally, this is how clinicians diagnose. You definitely have persons who are looking for that pleasurable element of a substance, meaning that feel good, that euphoria, that high. They're looking for that, but the more they get that, the more one has to use, which we call tolerance. So as a tolerance increase, that's additional information that we use that actually gives us information about a diagnosis for addiction. Then in addition to that, you have one who says, you know what, I don't even get high anymore. I'm using these substances, but I'm not getting high. I just need it just to be normal. That it's hard to get out of bed to fix a meal, or it's hard to take care of a child, or it's hard to go to school, or it's hard to, go to work. I'm just needing to use a substance just to get out of bed in the morning. Well, they're no longer getting high. They just need to be normal. So in addition to that, it's also a brain disorder. So if you take a look here, there's this big picture here of a brain. So our brain is our center of our nervous system that just operates so dramatically throughout, because it really centers around everything that we do. So drug addiction actually involves those functional changes that's throughout our brain circuit that is involved in our reward, our stress, and our self-control areas. So when we look at drug addiction as clinicians, there are three particular areas of the brain that we look at that is challenged as a result of drug use. And those three areas are the prefrontal cortex, the extended amygdala, and the basal ganglia. So I'm going to go through each of those areas and hopefully express to you what drug addiction does to those particular areas and how it operates as a person is trying to abstain from drug use, in addition to remaining and maintaining in recovery. So with the prefrontal cortex, which you see in that bigger picture, that is the area that is responsible for our self-control. So when a person is actually using a substance, that particular area of the brain becomes challenged. That is the area that regulates our ability to reason. We consider consequences. It helps us to not be impulsive. But when a person is abusing drugs, unfortunately, that particular region becomes compromised. Now, this is why I said initially, when we look at that universal definition of addiction, that it is continued use of a substance despite adverse consequences. Well, that is because that particular area of the brain has now been compromised. So there are so many things that we could do on a daily basis. We could become angry. We could eat what we want, and we not be concerned at all about consequences. But it's that particular part that helps us to consider some things. Well, you know what? I can't get too angry because this can happen. I don't want to eat too much of that because I don't want to gain too much weight. I don't want to do A because I don't want B to happen. Well, when a person is actually using substances for an extended period of time, that particular area becomes challenged and those consequences are no longer a priority of concern. So that's what you find when someone has been diagnosed with a drug addiction. Now you have the extended amygdala. Now the extended amygdala, which is the smaller picture down the bottom, is responsible for how we respond to stressful situations. So for persons who use drugs, typically this area becomes a little bit more sensitive when they are attempting to abstain from illicit substance use, in that it brings on the withdrawal symptoms. So we, in this particular area of the brain, when we are going through stressful situations that are in either environmental, whether it's physical, whether it's mental, this particular area of the brain is now activated, and it allows for us to be able to manage through those stressful situations. When we're looking at physical situations with persons who are abusing substances and have now been diagnosed with an addiction, this particular area brings on those withdrawal symptoms like irritability, depression, anxiety, and even that physical pain. So this in turn keeps the person in that drug-seeking cycle that makes them continue to return to drug use because they no longer want to experience and feel those withdrawal symptoms that are really uncomfortable, and they don't feel really good. So this is what keeps that person in that cycle. Now, the last area of the brain that I'm going to talk about is the basal ganglia, and this is what we call our reward circuit. So this is where we get those really feel-good feelings, those really pleasure responses. And this particular area of the brain is actually activated when an individual engages in any activity that creates a moment of really feel-good feelings. So when you look at someone who's eating that great meal, if someone is socializing with those great friends or family members, and even engaging in sexual intercourse, it creates those pleasurable responses. So I know right now we are in this pandemic, this COVID pandemic, that has really decreased and challenged us socially. So I'm going to give an example of how this particular area of the brain can be compromised. So because we've had to pretty much, for a while there, the world pretty much stopped. Socializing is no longer safe. We're getting better now, but nevertheless, we still have to be really cautious. So we're not engaging as much as we normally would socially, with our coworkers, where everything is virtual. Our kids are having to go to school virtually, so they're not engaging with their fellow classmates as often as they would. So that area has now been challenged, that we're not getting those really great pleasurable responses at this time. So we tend to overcompensate in other areas. So we hear about the COVID weight because persons turn to eating. Or you hear about, I'm sure Dr. Rita is, delivering a whole lot of babies because there's a lot of COVID babies being born because people compensate with sex. It's the body's way, the brain's way of being able to still have those pleasurable responses, even though we're not even having those social activities to get it. We're now turning to other ways. Well, it's kind of the same with persons who are using substances. They actually get into the habit, because in this area of that particular area of the brain, the basal ganglia, it's also responsible for how we form habits. So when there's one habit, again, participating and actively socializing with family and friends, when that's not happening and that's being challenged and we're looking for those other ways, then we form habits in other ways. And so those habits, whether positive or negative, are still formed in this particular area of the brain. And that person who is using substances, that's what's happening with them. The habit of that habitual use of that substance continues to be this driving force for that individual who's been diagnosed with that addiction. So they're looking for this euphoria. And when you're using a substance, the brain is now flooded with this dopamine, and that's what gives them that high. But as the body continues to, as a person continues to consume those, whatever illicit substance it may be, the brain begins to adapt to that, and it gets very much used to it. So when it does that, it kind of, slows down on being able to produce dopamine. So the person then has to use even more drugs in order to get those same feelings of pleasure. If they don't, without using, they have to continue to find a way to get those pleasurable feelings. And so that is what actually is activated in that basal ganglia. But with all of that, there is a flip side. So there's a flip side to addictions. Persons can live active, healthy, productive lives. And as a clinician, how we do that is with what you see there, and that is the treatment methodologies. So we have dialectical behavioral therapy, you have educational classes. Some people even attend self-help groups. There's one-on-one counseling, there's contingency management, we have cognitive behavioral therapy. So there's so many ways and avenues in which a clinician can use to assist someone in treatment that is trying to abstain from drug use. If they're actively using, or if they're currently in recovery, we help them to maintain. And these are the ways in which we do that. But I want you to pay attention for just a second about medication. We're going to talk a little bit about that. And the reason why I want to center around medication is because, and Dr. Rita is going to come after me, and she's going to talk a little bit about how CBD helps in that area. But nevertheless, most persons, and you'll find that there's this common denominator as I speak, that's going to speak to persons who are actively using, that will tell you that it's really not about getting high anymore. It really is about just being able to function normally, but also B, and that is to ward off those horrible withdrawal symptoms that I've even heard people talk about. Some of the withdrawal symptoms are so bad and so unpleasant that the driving force to continue to use that substance just continues to present itself because the person just absolutely does not want to participate and feel those withdrawal symptoms. And we'll talk a little bit about that. So let's look at opioid addiction. So again, we are still in the opioid crisis. While it has taken a back seat to the COVID pandemic, the opioid epidemic still exists. And as a matter of fact, it's at an all-time high. And why is that? Because persons have turned to substance use in different areas, in different forms, because of some of the stresses that have come along as a result of the COVID pandemic. So loss of employment, not being able to have those feel-good interactions with family members and friends. So persons have turned to substances to give them those feel-goods. Now, opioid use is very, very, very addictive, extremely addictive. Now, most persons, when you hear about the opioid crisis or the opioid epidemic, we're thinking about persons standing on the corner buying heroin. But there are persons who are actually suffering in this opioid crisis because of prescription medications. There are persons who are suffering with pains, and their physicians have prescribed them hydrocodone or oxycodone or Oxycontin or Demerol in order to manage that pain, because some people really do live daily with chronic pain. So as a way of pain management, physicians have actually, created, unfortunately, because we trusted that these medications were going to be helpful, that they were going to help alleviate some of these pains. But unfortunately, they've created other issues and challenges like the opioid addiction. So because of the severity of the withdrawal symptoms, I've heard people describe it. Some of my patients have even described it as feeling like death because the withdrawal symptoms are just that bad. So there's extreme sweating or nausea, they're vomiting, there's the body aches, the body pains can be so severe that they can't move. It becomes crippling. And then they have high bouts of anxiety and or insomnia. Well, if you were feeling that, you don't want to feel that. So what happens is that individual returns to the opiate use in order to get rid of those withdrawal symptoms. So one of the things that can happen is that a physician can prescribe medications to help in treatment. And we see this often. And so you have some, and the most commonly used medication for opioid addiction is methadone. So methadone is an opioid agonist. Now that means that it actually mimics the effects of the opiate drugs. So the same effects that happens with someone who is actually taking an opiate, the methadone mimics that. So in the body, it feels the same. So it wards off those withdrawal symptoms because it's as if the person is now taking an opiate, which it is because it's just an agonist. It's highly addictive as well. And there is absolute potential for overdose. Now, the next medication that can be used for an opioid addiction is buprenorphine. Now, buprenorphine, too, is an agonist as well. And oftentimes we find that it is combined with what we call naloxone. Now, naloxone is a drug that actually blocks some of the effects of the opiate, meaning it won't allow for that euphoria. And it also can help and maybe not allow for as much of it being an overdose potential. But nevertheless, when it is, and we also, and I'm, some of you may have heard, but may have heard the name, but it's Suboxone when it's combined with naloxone. It actually helps and is prescribed by a physician. It can be, gotten from a physician in outpatient treatment. But nevertheless, it still has an overdose potential, but it's not as high as methadone. So some physicians actually prefer to prescribe buprenorphine at this time, or Suboxone. The last medication that's used for opioid addiction is naltrexone. Now, naltrexone is a little bit different from methadone and buprenorphine, that it is an antagonist. Instead of being an opioid agonist, it's an opioid antagonist, which means it blocks the effects of the opiate drugs rather than mimic it. So it's also sometimes used in alcohol treatment, but there are some really, really, really unpleasant side effects. And so most persons will opt not to take the naltrexone because of the side effects that they feel. So let's look at cocaine addiction. So cocaine, again, highly addictive. It's actually the second biggest killer after opioids. It is there, some really powerful and strong cravings that comes from persons who are trying to abstain from using cocaine or trying to be in recovery from cocaine use. The cravings can be pretty severe and pretty strong. But in addition to that, there's still withdrawal symptoms that comes as well. And you may find fatigue, you find anxiety, irritability, agitation, and or paranoia. So when a person is going through the bout of recovery, and they're on a journey of recovery, and they know that they no longer want to use cocaine, those withdrawal symptoms are so strong, those withdrawal symptoms are so uncomfortable that they oftentimes return to that cycle of drug use. And that is going to be the pattern that you hear in the substances that we're talking about. So when it comes down to medication for cocaine addiction, right now there really aren't any medications that's been approved by our U.S. Food and Drug Administration to treat cocaine addiction. But, research will continue and maybe one day there will be. But right now we just manage symptoms, withdrawal symptoms. So the next we have alcohol addiction. So, alcohol, we know sometimes, people don't really look at alcohol as being addictive. And I've heard people actually say that it's not addictive. Anyone can just stop drinking whenever they want to. In addition to that, people don't think it's really a big deal because it's so highly accessible. Throughout, again, the COVID pandemic, things shut down, businesses shut down, churches shut down, but the local neighborhood liquor store did not. And so as a result, we have these unprecedented rates of alcohol use that has just continued to increase and climb because it's just so highly accessible. And whatever's going on in the world, liquor stores just don't close. And so persons have these alcohol addictions, and there's major, major repercussions on the body with extended alcohol use. And again, Alcohol withdrawal is just yet another reason why you find that persons will continue to drink. So you have anxiety. And again, look at the pattern. Look at what some of these withdrawal symptoms are. You've heard these as I've talked about opioids and I've talked about cocaine. You have anxiety, you have irritability. There's some who suffer from sleep disorders and tremors. You have the sweating and the nausea and hallucinations. And I've found that persons who are trying to abstain from alcohol use, who are experiencing hallucinations, they experience all forms of hallucinations. So there's audio hallucinations and visual hallucinations and olfactory hallucinations, meaning they smell things that aren't there, or tactile hallucinations, meaning they feel things. They may feel things crawling on their bodies, or they can feel that something's sticking them, like glass is going through their skin. And these are all, again, withdrawal symptoms that a person experiences when they're trying to abstain from alcohol use. Now, there are some medications that a physician can prescribe to assist the person who is suffering from alcohol addiction. And one, we have acamprosate. Now, acamprosate is a medication. It does not treat withdrawal. And if it's taken, and if you take too much for too long, it can definitely cause serious side effects. But what it does is, with extended use of alcohol consumption, it really alters the brain. The brain is altered with significant alcohol use. Well, what acamprosate does is it helps to reestablish some normal brain function. So a physician may find it necessary to prescribe acamprosate to assist a person to be able to alter and kind of help improve the brain functioning. Another medication that is used for alcohol treatment is Disulfiram. And some of you may have heard of that as being referred to as antabuse. Now, antabuse does not treat withdrawal either, nor does it prevent the craving for the alcohol. But what it does is it pretty much just discourages alcohol use. And meaning that when a person is actually taking Disulfiram and they drink on top of it, the side effects are extremely unpleasant. A person becomes violently ill, which actually makes this level of treatment for someone who is trying to abstain from alcohol use really not effective. Most persons will not opt to continue to take Disulfiram because they really just don't want the possibility of experiencing such an extreme side effect that they would feel and experience if they're ingesting alcohol on top of it. So it really isn't a key effective treatment for most physicians when persons are going through treatment. So then we have tobacco addiction. Now, we know that this is another widespread problem. Again, we don't hear a lot about tobacco. We were seeing commercials all the time about tobacco use and the health risks that are associated with tobacco use. But nevertheless, it still exists. And now the withdrawal symptoms may not be as severe as an opioid withdrawal or cocaine withdrawal, but nevertheless, it's still enough that keeps people in the cycle of continuing to smoke tobacco because they don't want to feel those withdrawal symptoms. And it's still the anxiety and the irritability. Have you ever seen someone who is trying to kick the habit of smoking cigarettes? I mean, they are not the easiest people to be around because the irritability is at an all-time high. So those are those withdrawal symptoms that keep people, in spite of knowing that, the health risks that are associated with tobacco use, they continue to smoke anyway because they just don't want to feel those really not good feelings. So what a physician can do is prescribe, and then there's some over-the-counter as well. There's some nicotine replacement therapies that consist of things like patches or gums or sprays or lozenges. But nevertheless, if you've listened to all of this, there is this constant theme. And the constant theme is persons who are trying to abstain if they're in active addiction, or those who are trying to maintain a sober living lifestyle, there is this constant theme of not wanting to return to the withdrawal symptoms, not wanting to experience that anxiety or those mood swings, or that physical pain, or the inability to sleep. Because a person who can't sleep, they're not going to be the best as well. They're going to be highly irritable if you're not getting enough sleep at night. So it's like this puzzle that just one piece kind of fits into the next. And so when we're trying to address addiction in totality, we have to look at all of those factors that kind of leads a person and keeps them on that hamster wheel of that vicious cycle that we call drug addiction. And so with that, I'll say this. Addiction is a complex but treatable disease. Okay, it's treatable. It's complex, it's difficult, but it can be managed too. There is no single treatment that's right for anyone. You know, what may work for one may not work for another, and vice versa. There's no cookie cutter response to drug addiction when it comes down to treatment. It really is based on an individualized treatment plan that is based on that particular person's needs and that particular person's situation, because environments change. There's so many factors that go into treatment when we're looking at trying to help a person get from point A to point B. Counseling, definitely, and behavioral therapies are the most commonly used forms of treatment. While medications can be a part, we definitely look at counseling and behavioral therapy to help persons learn how to manage on a day-to-day basis. Treatment should not just address the actual drug use, but it also should address what some of those possible mental disorders could be as well, because we do like to look at the whole person. And we know that sometimes at the center and the core of drug use often are some unidentified mental disorders. Now, there are no cures. We're talking about treatment options. These are options that present themselves, but there's certainly not at all a cure. And if someone is suffering from addiction, it is very, very important that they seek professional help. And so with that, I'm going to now turn it back over to Dr. Rita as she shares with us about CBD and how it can help with some of those things that I just talked about.
Wow, thank you so much, Dr. Conte. I want everyone on the webinar to put your questions in the chat, because I know that you have questions that are just forming in your mind. We want to make sure that we have time to answer those questions at the end, but wow, that was just so informative. So many great nuggets that we have to really help those that we love and know that suffer from addiction. So thank you again. So we're going to move on to how CBD can assist support with addictions. I'm going to start here. We talked about, substance abuse disorders, such a great information. And what I really want to ask at the end of our conversation, because we know that substance abusers, they have drug cues. They're vulnerable to stress. That can trigger things. Anxiety can trigger. And having an impaired impulse control is really an issue. So as a number of people who suffer from drug addictions in the US, and this continues to rise, we absolutely want to investigate and look at alternatives that are holistic and natural for those. And that is CBD. CBD, or cannabidiol, is one of the compounds from the cannabis plant. But in its purest form, the forms that we always talk about each and every week, is that CBD is non-psychoactive and non-addictive. So CBD is very much a very attractive candidate for use as a therapeutic substance for those who abuse substances. And we talk about how CBD works. And what's really interesting is Dr. Conte went over areas of the brain that are affected by substance abusers. And so the human endocannabinoid system is the science behind how CBD works. This system is the most vital regulatory system in our body. And it works by, when one consumes CBD, it binds to receptors in different parts of the body. And really, we're mainly talking about the brain. We're talking about the central nervous system. And we cannot forget the periphery, and the immune system. Because again, when we speak about the withdrawal symptoms that many that are addictive or abuse substances, one of the reasons that they are abusing opioids is because they have pain, right? Their physician, like myself, has prescribed a pain medication for maybe their knee replacement that they had, or a hip replacement. Many people that have fallen into an opioid abusive disorder is because they legitimately were given opioids for either a surgery or a condition that is resulting in severe chronic pain. So when we look at the human endocannabinoid system, what do we find? We find some of the same parts of the brain that Dr. Conte spoke about, right? The basal ganglia, the cortex, the cerebellum, the hippocampus, the amygdala. All of these areas have a role in the reward center and pleasures that those who are addictive and abusing substances. So the opioid epidemic, Dr. Conte hit it right on the head. You know, the global pandemic has taken light off of the opioid epidemic, but it's a real problem. It's a real problem. It's causing over 300,000 deaths in 2019. She spoke about the agonists, those drugs like methadone and buprenorphine that we use to help those that have opioid addictions. But what happens? These drugs too are highly addictive. They're highly, because they're agonists and they mimic these drugs, they can be misused and also not be as helpful. But we are looking at CBD for its non-addictive, its non-psychoactive treatment for the opioid use disorder. So the opioid crisis, again, when we look at those who in 2019 died, unfortunately, from 70,000 from drug overdoses, we look at 1.6 million people misuse prescriptions that we as physicians have given for pain relief. And so that's why even our topical products that we're going to talk about have a role in helping to reduce those who are using opioids for pain. So when they looked at the research, you know, the research that in 2016, they studied and surveyed 244 patients who had chronic pain. And what they did is that they offered these patients a CBD. And what they found is that there was a 64% decrease in opioid use. There were further studies in 2017 where they looked at 175 opioid using patients. And after 7 months of using a cannabis product, 44% were able to discontinue their opioid therapy entirely. So we're looking at a crisis that we absolutely can make a difference with CBD. Further research, we know when we talk about how CBD has been very effective in the seizure disorder. In fact, we talked about seizures and epilepsy last week. We know that CBD is an anti-inflammatory, it's an analgesic, it's a great pain reliever. But there's further research that shows that CBD can control cravings, those cravings that Dr. Conte spoke about that's associated with substance abuse. Now, when we look at addiction, we always talk about, again, that the reward system is something that your brain helps you survive. You know, it lights up when you eat certain foods. You know, you can be addicted to food, to sex and other things, but this reward system is damaged when we have those patients that use alcohol or painkillers or any illicit substances. So this reward system now is confused, and it's making your brain think that you need this substance to survive. And this is how we get into addictions and cravings. So studies again have shown that because those receptors that are found in those certain areas in the brain that regulate and modulate the reward system, it helps to reduce cravings and helps to calm and even regulate that reward system. This helps to prevent relapse in those who are addicted. Again, there is a role, a potential role in addiction treatment with CBD. How does it do that? Well, it impacts the brain circuitry. It helps to reduce cravings. It helps to release anxiety and stress, which can be a trigger for those who are addicted. And it helps even to reduce depression. So all of these triggers can be impacted by CBD and reduction. Let's look at alcohol and cocaine. There was a study in 2018, and what they did is they looked at CBD in animals, and its use in animals, with those rats that were given cocaine and alcohol. And what they found is that after 24 hours, for 7 days of giving these rats who have been addicted now to alcohol and cocaine, that the CBD affect the relapse conditions such as stress, impaired impulse control and anxiety, and also it was a long-lasting result even with a 7-day usage. So they found that the long-lasting effects of reducing anxiety, reducing the impaired impulse control in these rats that were addicted to alcohol and cocaine was very, very significant. I think many of you may remember those commercials when they showed the egg and they said, this is your brain on drugs. Well, again, many of these drugs like heroin can cause damage to the brain. It's a neurotoxicity. You know, alcohol is a neurotoxicity. That means that it's toxic to the neurons in the brain. And so on the left, you see a healthy brain. On the right, you see a brain that's not as lit up of a drug abuser. So what happens is that CBD has been shown to repair damage. It helps to improve cognition. We talk about how CBD is a neuroprotective. It helps to protect those nerves and neurons that have been damaged with drugs like heroin, with alcohol. So this study had 42 men and women. They had a history of heroin abuse. And what they did, they divided this group into 3 groups. One group was taking 400 milligrams of CBD every day. One group was taking 800 milligrams of CBD every day. And one group was a placebo, didn't take anything. They gave CBD for 3 consecutive days. And what did they show? Well, what they did was they showed these participants a neutral video, a video that was calm and serene. And then they showed these same participants a video that had drug-related cues. It gave them some cues that triggered their drug craving. What they found just in 3 days is that those participants that viewed the drug-related cue video had less cravings than those who were in the placebo group. So the results were that CBD reduced anxiety, it reduced their heart rate, it reduced their cortisol, that stress hormone, it reduced their drug-related cues even when they were triggered. So very, very powerful study that was done. So when we look at how CBD can help with opioid addiction, you know, it can help by, 1, reducing the cravings. We talk about how the pathways in the brain, when we have dopamine and serotonin that Dr. Conte spoke about, when those levels are high or out of balance, the CBD brings that back into balance. It also helps to reduce those conditions that folks are taking opioids for, right? They're taking opioids for pain. And so we know that CBD not only is a powerful analgesic and anti-inflammatory, but it has other properties in helping to reduce anxiety, being an antidepressant. So CBD is a viable treatment option and an alternative without causing further addiction, without being psychoactive, and without giving that person that high. So there's a lot of research, and you can contact myself and Dr. Conte. There's a lot of research going on currently investigating CBD as a therapeutic solution for drug addiction, for drug relapse, and many, many more things. So let's look at our products here at Wakana. And again, we have to make this disclaimer that the FDA doesn't approve, or these statements have not been evaluated by the FDA. The FDA does not allow us to say that this product will cure, mitigate, or treat your addiction. You know, we talked about there is no cure. There are treatment options, but there are no cures. But CBD is absolutely a viable option for those. You know, our tinctures are products that you place underneath the tongue. And we're going to discuss at the end. We have about 10 minutes to take Q&As at the end. But we talk about how some of us have met those who have had addictions or are been sober for years, and they're afraid to try different products if they're even sourced from a plant that's even close to a drug, right? Those drug triggers are real. They're real because they can come from things like stress. They can come from things like this global pandemic that's caused the inability for us to really socialize like we're used to socializing. So tinctures are a great product that would have less of an impact or a trigger in those. This is an oil you place underneath your tongue twice a day, 3 drops twice a day. And we have 2 different lines. We have a power line. That's our full spectrum line of CBD tinctures that have the legal limit of THC, 0.3% or less. And then we have our pure line. That is our broad spectrum line that contains less than 0.0% or less of THC. So tinctures are a great way to help bring calmness, reduce stress, anxiety, depression. And again, CBD has been shown to work in the pathways in the basal ganglia in different parts of the brain to help to address that reward center. And then there's edibles. I mean, gummies are a great, great way of consuming CBD that will give you all of the benefits and support. You know, if you have someone that you know that has an opioid condition or substance abuse with opioids, maybe that person is that family member or friend that had, again, a surgery. That's why when I do a hysterectomy or a C-section, I don't send my patients home on Tylenol number 3s or Vicodin, right? After their post-op period in the hospital, there's no need for any opioids. So CBD is a great way to help to address those symptoms that maybe a post-op patient has that may be on an opioid and wants to get off. You know, gummies are something that takes about 30 to 90 minutes before it gets into your system. You know, we talk about those who have substance abuse or addictions. They have difficulty sleeping. So these gummies will help with sleep, will support insomnia, will support inflammation and pain, and also reduce cravings. Again, our Delta 8, our newest gummies on the line here, 50 milligrams of CBD, again, addressing those with sleep, need sleep support, or help with other issues that we talked about in addiction. And then the smokables are a great product for those who are addicted to nicotine. You know, we talked about the nicotine addiction, our vape oil cartridges, our pre-rolls, our flowers. And we're going to talk about and we're going to address, you know, is a smokable something that you want to give someone that may possibly be triggered? But this is absolutely a product for those who are addicted to nicotine. Why? Because CBD helps to block that reward center that causes that craving and addiction. And then our topicals. Our topicals are absolutely needed. Topicals offer local relief to pain, right? The opioid crisis happened in the early 1990s when I was in medical school. Why? Because we were taught that pain was a vital sign. It was the fifth vital sign. And so we were taught in medical school to treat pain with opioids. Yeah, opioids. You got pain, I give you an opioid. Not let's try some other sorts of less addictive medications, but straight to opioids. Fast forward, we have this opioid epidemic. So our topical pain relief, our 400, our 200, our 500, our Dr. Rita's Rub is a great option for topical relief. And then there are products that those who have addictions can use in the kitchen. Our spices, our butter is just a great way to introduce CBD in the system without have a possible trigger. And then essential oils. Essential oils are something that can be very relieving and relaxing. You know, putting some of these essential oils in a diffuser. I love using peppermint because it gives me energy. So essential oils are also a very vital addition to our product line. So I'm going to open it up right now for questions. I do want to just kick it off by asking Dr. Conte a question, and that is, how do you introduce a product like CBD, which is a constituent of cannabis, to those who have an addiction, those who may be fearful that it may cause a relapse, it may cause, again, that cycle to begin?
Well, okay. So, and Dr. Rita, I think that's an excellent question because we hear that a lot. Now, one of the things that we have to talk about when we're looking at persons who are in recovery from any illicit substance, there are always going to be triggers that exist. And that means, you know, it could be anything from a particular area that one has been used to going to a family member's home, or, you know, when we look, you know, you talked about addiction around eating, or, you know, we may have a mall that we go to, then every time we go to the mall, we get that particular Cinnabon, or there's a particular food that we love. We know that we go to this particular place, we want to get this. Persons may look at, say, for instance, a smokable CBD product and say, well, you know what, if I smoke a pre-roll, it's going to trigger that craving for me to want to use something else. And we can't deny that that exists, but it doesn't exist any more than any other trigger. What happens is, in treatment, we teach individuals how to cope with that. There are going to be some triggers that are avoidable, and then there are some triggers that are unavoidable. So let's give an example. An avoidable trigger may be Elm Street. You used to frequent Elm Street. Elm Street is where you purchased the substance. Elm Street may be where you sold an illicit substance. And when you go to Elm Street, you get this feeling that you now want to return to whatever your drug of choice was. Well, in therapy, we teach you how to cope with that, because on Elm Street may be your children. That may be where your children live. It could be where your parents live. And so you can no longer avoid going to Elm Street. But we teach you ways in which you can now cope, because you're in recovery doesn't mean these triggers are no longer going to exist. but you find other ways around it. So the blessing with Wakana products is that if indeed you find that a smokable product triggers a response that may manifest itself in a craving, then you can now go to another form of CBD consumption, like the seasonings or a water soluble, and that you don't have to actually use the smokable product. Just like I may say, okay, instead of going directly to Elm Street, you may need to go another way. You might need to park in the back of the home versus going to the front of the home. So there's always going to be a strategy that one can learn in treatment how to manage, because again, the world is still going to continue to exist. It doesn't disappear. Family members that you used to use with, they don't just die off because you're now in treatment. That particular family member that triggers that response, when you see them at a family dinner, or you talk to them on the phone, it could still trigger that craving, but they don't just die off because you're in recovery. So we teach you and you learn how to cope and manage through that. So again, with the different products that Wakana offers, if indeed one creates a challenge for you, then a person can now go another route and use another product that doesn't, and all while still gaining the benefit of using the CBD. And I hope that answers that.
Yes, it does. It does. Is it safe for ex-cocaine users to use CBD?
Absolutely, absolutely. One thing, and everyone who's listened, and the echoing message is that CBD is non-addictive. It's non-addictive, and it is certainly going to target those areas in your body that are deficient, along the lines of the anxiety, the irritability, the pain. It's going to target those areas. So it is absolutely safe for an individual who is an ex-cocaine user to use. Absolutely. It can only help. It can only help.
Fantastic. Are there any other questions? This was a great presentation, Dr. Conte. Everyone is going crazy on the chat.
Awesome.
Fantastic. Can a person overdose or overuse CBD?
Absolutely not. There has been no research found that has shown anyone that has overdosed from CBD. And I think, Dr. Rita, you've definitely given us great information on that before. But nevertheless, again, it's non-addictive, and we have not found any cases. Now, you know, there are research studies, and you may talk to different physicians that have different information around the effects and benefits of CBD. But nevertheless, overdosing has not been one of those things that has been found. So it is definitely safe to use.
Yes, and I would just add that it's up to 1,500 milligrams a day that they've seen that is a safe and well-tolerated dose. I mean, many of us will never use that large dose, but just know in some people, if you take too much CBD, you may have minor side effects of nausea or maybe a headache. But as far as overdosing on CBD, no.
Absolutely.
Does smoking damage the lungs? Does smoking CBD damage the lungs?
Again, CBD consumption is safe on our organs. And when we talk about that homeostasis, it brings us back into balance. It doesn't damage. Again, and it's beneficial and effective on helping the lungs and the brain and the teeth and the stomach and the bladder. So it definitely serves as an effective tool versus a damaging agent.
Absolutely. And for me personally, if someone is asthmatic or COPD, emphysema, there's so many other ways, as Dr. Conte has said, to consume CBD. That's not probably the very first product that I would choose for someone who has challenges with their lungs. I would go for other products and consumption, like the tinctures, like gummies, like the spices. So if there is some compromised lung issues, certainly smokables are not the first line of products that I would choose for that person.
And
Any other questions?
And 100%, if there's a medical challenge that you're facing, you want to always talk with your physician first anyway, to let them know that this is something that you are interested in trying, and get their professional opinion based on your particular medical issues, and let them give you a plan for that.
Fantastic. Oh my gosh, this is just a wealth of nuggets and great information, and just a lot of information that we can take back to those who may have reservations. Because, the last thing someone wants to do that's in recovery or is, really still struggling is to have a setback.
Absolutely.
And we have found that CBD is absolutely a viable therapeutic option for those folks who are suffering from addiction.
Absolutely.
So, yeah. So thank you so much, my soror. Thank you, all of our business partners. Oh, I forgot to look at the Q&A. Okay, so how does CBD help people that suffer from chronic pain? And can I just smoke the weed that I get from one of my neighbors? Doesn't that help with addiction? And if someone is on methadone, what product can a person use to help with not taking it anymore?
Well, I have to tell you, with methadone, that is not something that you want to interrupt with anything. You want to definitely, that is highly regulated, and that is highly monitored by a physician. So if someone is taking methadone on a daily basis, then you want to first consult the physician that is prescribing the methadone, because there's a process by which one must take. And if you remember in the presentation, I talked about methadone being just as addictive. So you cannot interrupt that use immediately. There are some effects, side effects that can happen that can be more than just not pleasurable. So there is a step down process that must happen in order for someone to stop methadone use. But as a person, and what we call that detoxification, but as a person is detoxing from methadone, they may experience some unpleasantness, but a doctor will typically, depending on that particular person's situation, they'll determine what that detox process should look like. But while that person is going through that, they may experience some unpleasant feelings. Now, the CBD products, like the smokable products, the tinctures, the vape cartridges, those, and the gummies, those may be some forms of consumption that could help get through some of those unpleasant feelings as a person is going through a detox. But again, I would never, ever recommend that someone just stops and totally interrupts methadone consumption without going through a proper detoxification process. So that should be discussed with the prescribing physician immediately first, and then those things can absolutely help during that process of detoxing.
Wonderful. Can I just smoke the weed that I get from one of my neighbors? Doesn't that help with addiction?
That's not going to help you with addiction. The weed that you're getting is probably THC, and that has those are additional challenges. You're better off going with the CBD product to help you through that versus adding to the issue. And that's what the tetrahydrocannabinol is going to do. So I would highly recommend that you go with a CBD product rather than your neighbor's THC.
Wonderful. And how does it help people that suffer from chronic pain?
Well, we know that CBD absolutely targets the pain, and all of the products that Dr. Rita just went through for sure, like the gummies and the tinctures, the CBD products, period, the topicals, they're going to help with that chronic pain. And it's because of that endocannabinoid system and how those CBD products work with those with those receptors that are in our bodies. And so that's the way that you're going to target those chronic pain issues that exist for whatever reason. The CBD is going to help with that.
Wonderful. I just want to ask Mark Anderson, did you want to say something? Mark Anderson just put in the chat that he's been in recovery for 32 years.
Awesome.
Isn't that awesome?
Absolutely awesome. Congratulations to you, and 32 more to come.
That's
32
right.
more to come.
Absolutely. Well, thank you, Mark. We'll catch you on another. Oh yeah, let me just unmute him and see. Let's see if we can get Mark Anderson to give us some insight to see if he is using any of our products, if he's a guest, if he's a business partner. You can unmute yourself, Mark Anderson. There you are.
Good evening.
Good evening.
Hi, how are you? Congratulations.
Thank you. I'm a distributor, and one thing I've talked to people that I know they're in recovery is that there's a way to live a better life than on pain pills. And I found that from my own personal experience with my knee and with my back, that the pain cream and the gummies do help. And I'm glad that there's an alternative for those that are like me that don't want to take medications, but we have to, because living with pain can be very, very, very difficult at times. So I'm just grateful for what you all did. It was very well informed, very well put together. And I just want to thank you.
Absolutely. You're very welcome, and congratulations. And we're going to claim right now another 32, 42, 52 years.
Right.
Let's just do it one day at a time.
That's right. That's right. That's right. Awesome. Oh, absolutely awesome.
Thank you so much, Mark, for sharing. That is going to help so many on this line.
Definitely.
Thank you so much, Dr. Conte.
Absolutely,
this was
Dr.
Fabulous, fabulous. And thank you to all of our business partners, all of our guests. If you're a guest on the line, please connect with the person that invited you so that you can get these products and that we can really lock arms with you and show you more about who we are here at Wakana. So have a good evening. Thank you so much, and we'll see you next week.
All righty. Good night.
Good night.
Good night.